Changing subjects now. For months, Idaho hospitals put a call out for more nurses to help their overwhelmed and overworked staff as COVID cases reach unmanageable levels. And today, the good news is that cases are down and most hospitals are back to more normal operations, and the need for extra healthcare workers continues to dwindle. Now, travel nurses that had been contacted and contracted to help us get through the worst of it are now coming up on the end of their contracts. And for those who are getting an offer to renew, it's at a much lower rate. According to NBC News, the demand for travel nurses nationally has dropped by a third from early March to early April. So what does this look like for us locally in the Treasure Valley and in Idaho? And what are Idaho hospitals doing to handle this tricky situation? Our Katya Stepovic reports.
This graph from one of the top travel nursing agencies in the country says it all. The demand for travel nurses in the U.S. has plummeted. During one of the recent peaks of the pandemic, there were 37,000 open positions. In April, that number dropped to 14,000. And here in Idaho,
the demand for travelers is definitely going down.
Take it from Clint Child, Chief Nursing Officer at St. Alphonsus Health System.
It's a sway back from, what was really a crisis in healthcare to getting things a little bit more under control.
St. Al's brought on upwards of 250 travel nurses to help with the demand during the pandemic.
When the need exceeds the resource there, that's when we are forced to look to, these temporary contracts.
Now, many of those travel nurses are reaching the end of their contracts.
I wouldn't say it's a layoff. It's we end when their contracts end. Either we extend or we don't. So we've been able to not extend contracts and even renegotiate with their agencies some rates that then they accept or they don't. And the nurses make wages that are attractive, and they make more than a bedside nurse because it's not a permanent position. There's no benefits and things like that.
Child says St. Al's tries to offer most travel nurses the option of moving to a full-time position within the hospital.
We had a lot of healthcare workers decide to leave the industry. We've done countless stories on that. So did that kind of open up slots for travel nurses who decided to stay?
It did, and that was kind of the preface for why we had the big need initially was the increased demand and the number of people that were getting sick with COVID, as well as people that were leaving healthcare, and all of those combined really ended up with the nursing shortage that we went through.
But not all travel nurses are choosing the full-time route. The average travel nurse salary is about $156,000 a year. The average salary for a full-time registered nurse in Idaho is around $73,000, 11% lower than the national average.
They love the area, they love the working environment, but not all of them have taken on positions with us. Many of them still want to move through and do their travel positions. So when the travel need dries up locally, they move on.
But whether the reason to move on is the money or the desire to travel, Child says for them now the focus is local and long term.
We're still down. We do focus on our internal nurses and making sure we're supporting all of them, what they do every day, while making sure that we've got enough supplemental staff to help them. But the focus is definitely on the permanent and the long-term nurses.
And I did reach out to St. Luke's to get their thoughts and what they're going through on travel nurses as well. They said in part, quote, "We have taken a thoughtful and gradual approach to level off in our hiring of travelers where possible. And while we do not anticipate a sharp drop off in our utilization of these nurses, we are working on creative and innovative ways to replace them, of course, with permanent staff." Now, that is the goal here. But regardless of that, Joe, they did tell me that pay for these travel nurses is down 45% than it was at the peak of the pandemic. So they're not getting paid as much, but some would argue more than these full-time nurses here.
Well, it's a tricky situation. It will be interesting to see how hospitals in our community and across Idaho balance that in the coming weeks, because you want to reward the people that helped you out, but if you don't need them, you don't need them. All right, Katya, thank you for that report.